Tonight, the medical director of the Owen King EU Hospital calls on the family of a patient who died at the facility to come forward to make formal complaints. Education officials confident that students can make a safe return to classrooms on Monday. And CDC residents speak following objections raised by an SLP hopeful about the choice of colors for repainting the buildings. The details of these stories and more coming up.
This is the Hot 7 Nightly News with Lovelace and Amy Joseph.
Good night. It is Wednesday, the 6th of January, 2021. Welcome to the Hot 7 TV Nightly News. I'm Lovely St. Amy Joseph. Thank you for joining us. The medical director of the Owen King EU Hospital, Dr. Alicia Eugene Ford, is promising a thorough review of claims made by the family of a patient who died at the hospital on Sunday, the 3rd of January, 2021. The family of the deceased questioned the level of care given to their loved one and the level of professionalism of staff who they claim were on their phones and laughing as the patient was in distress.
I've noticed that other complaints were surging, and that would have included persons using their phone regularly, persons actually laughed at the patient when she fell down, and that was cause for concern. When it comes to using of the phones, some of the staff are allowed to use, some staff members are allowed to use the phones. And I'm talking about the physicians, for instance. I do not think that every staff member in the accident emergency department should have access to their phone during working hours. So that is why it's very important that the family members, the next of kin, along with family members who are concerned, to come to the administration department of the Owen King European Union Hospital and make their complaints. I think every single complaint is valid, and I think that if you have one or two members of staff that they can pinpoint, they may not know the name, but they may be able to describe the person and say, this is the person responsible for using their phone all the time. This is the person who was laughing at my loved one when he or she fell off the bed. Then that would give us an idea of, allow us to zoom down on the person who did that.
The hospital director, Dr. Eugene Ford, explains that the patient presented to the facility at 10:49 a.m. and was assessed to be clinically stable. Hours later, the patient was dead. The hospital director says any matter such as this would be reviewed by her.
They saw a physician 2 hours afterwards. And after seeing the physician saw the patient, gave instructions to the nurses so that they can start the treatment. And that was done. The treatment was starting to give. According to our notes, we could have seen that the documentation and the time where the treatment was given. That particular patient was re-examined again at 3:50 p.m., which is 2 hours after the first the initial examination by the physician. Then the physician went back to look for that patient at 4:30 p.m. The patient was then re-examined at 5:30 p.m., which is an hour difference between the two. And then, unfortunately, at 6 p.m., the patient started to deteriorate very quickly, which was a sharp decrease from the vitals from when they came initially to what was happening at 6 p.m. Now, I just want to make it clear and let persons know that when we have a case of that nature, whether family members complain or not, the clinical team in charge of the case would inform me as the medical director. It's important that we review cases, not because family members are complaining, but we need to review cases to see what we could have done to improve care or what we could have done differently.
The medical director says there were no suspicious late entries of information into the patient's chart. However, she is calling on the family to make formal complaints to the hospital so that their claims can be thoroughly investigated. She says all hospital clientele have a right to bring their issues to the administration.
Whenever you have a situation at the hospital, whether it be OKUH, whether it be Victoria Hospital, the administration department is open. And it's open, we haven't opened a policy. We don't want persons to feel that if you come and complain about the staffing or you have an issue, the next time you come back, you will not be treated fairly or you will be victimized. We have a way in which we can sit with you and speak to you and find out your challenges, try to zoom down on the staff that is doing that to you and to make your stay better the next time you come in, because challenges exist, and sometimes it's through the patients that are complaining or family members that complain, we can actually see the way in which we can improve the whole process.
That was the director of the Owen King EU Hospital, Dr. Alicia Eugene Ford. Now, in news further afield, protesters stormed the U.S. Capitol and halted election debate on Wednesday. The protesters swarmed the Capitol building and forced a lockdown, halting the debate in the House and Senate. Congress was meeting to confirm President-elect Joe Biden's Electoral College victory. Some Republicans are trying to overturn the results in some states, but lack sufficient support. Vice President Mike Pence says he will not block the certification of Biden as president-elect despite demands from Trump. Trump has addressed thousands of supporters in Washington, D.C. and said he will never concede.
Actually looking at video right now of these anarchists interaction and these people who were involved in this insurrection. They broke the glass in the United States Capitol and now they are climbing through the window. This happened moments ago on the grounds of the United States Capitol.
Look at this. These protesters are inside Statuary Hall right now. You see the statues. This is a moment I never saw in my life. These individuals just rushed through security. They are inside Statuary Hall. This is a legendary place where all of us who've covered Capitol Hill, it's hard to believe what we're seeing right there. They're just walking through. Where are Capitol Police? It's an awful situation. They're having a good time in Statuary Hall.
That report from the BBC. The education sector prepares to welcome students back to classrooms on the 11th of January. Education officials are expressing confidence that the institutions are prepared for the return to face-to-face instruction. They held a press conference on Wednesday to outline the plans that will allow for the safe transition, which involve a number of school-specific protocols. Nisha Charles tells us more.
Increased airflow and ventilation in classrooms where possible, signs encouraging good hand hygiene, and ensuring that garbage is removed daily and disposed of safely are just some of the measures to be instituted by schools across the island as students are scheduled to return to the physical classroom on Monday, January 11. Amidst concerns by the general public, particularly parents, on the safe reopening of schools, education officials sought to reassure the masses that face-to-face instruction was more beneficial than students remaining at home. Chief Environmental Health Officer Parker Ragnanan emphasized the adherence to safety measures at all times.
As we look at the school-specific protocols, there is need for us to look at each individual school on an individual basis because the circumstances change from school to school. We talk about the physical environment, we talk about the physical infrastructure, we talk about the number of students assigned to the school, and these all makes it different on a school basis. And therefore, we believe that one size does not fit all. And that is the reason why we continue to encourage our partners at the Ministry of Education, and especially those responsible for the schools, the principals, to look at ways of making it work.
Chief Education Officer Dr. Fiona Philip-Meyer says that the education sector continuity plan played an integral role in fine-tuning the decision to return to the classroom.
All schools were on a whole school approach. As of September, they're returning to a whole school approach. We do have 34 schools that will be still on the alternate day approach because of the numbers that they have as part of the phased reopening of school. But what we've endeavored to do is to ensure that all of those students in those 34 alternate day schools get at least 3 days of face-to-face instruction, complemented by online presence and a virtual learning platform.
The Chief Environmental Health Officer sought to justify the need to reopen schools amidst rising cases of COVID-19.
COVID-19 is not going away anytime soon. Therefore, we need to be able to coexist. It would seem that COVID-19 is going to be another disease that we have, just like you have the normal flu and you have HIV, AIDS, and so forth. And it means that we have to be ready to manage COVID situations. I think as a country, we've done tremendously well in terms of our level of preparation, both at a Ministry of Health, and if we look at our respiratory clinics, there are respiratory clinics available. We are also being guided by international agencies such as the WHO. Therefore, even as we see the cases are increasing, we believe that we have a better hold on the COVID situation at this point in time.
As for early childhood education centers, the Chief Education Officer says the education sector continuity plan also applies to them. Special protocols have also been designed for special education centers. For the Hot 7 News, Nisha Charles reporting.
Education Minister Dr. Gail Rigobert says the decision to reopen schools for the second term of the academic year was a collective effort by many stakeholders, including the Ministry of Education, Ministry of Health, and other agencies. The minister spoke specifically to the education sector continuity plan.
The meetings held over the last 2 or 3 days in particular have been very detailed, outlining the various education-specific protocols and, very importantly, the education sector continuity plan in a COVID-19 environment. The latter is the outcome of a joint effort by the many partners aforementioned who participated meaningfully. I wish to thank the very hard-working caretakers, watchmen, groundsmen, and janitors who have had to work exceedingly hard to guarantee the readiness of schools to receive students.
The minister highlighted that in some cases it is not only the need for students to have the advantage of face-to-face instruction, but also the need for nutritional support. She is pleased that upgrades to the school feeding program can be rolled out to students who are in need of it.
One of the issues we struggled with when we were previously forced to close schools, and among the issues we've had to consider with respect to reopening of school include, 1, the nutritional support that many students benefit from while in school, which means that when they are out of school, we cannot guarantee that they are getting the requisite age-appropriate nutritional support. Further, though it is an unsavory topic, for many of our children, school is the only safe space that they know. And our school counselors, who fall under the leadership of Ms. Eugene, along with other stakeholders, have been very keen to ensure that we can bring those students back into schools, which is really, for many of them, a very safe space.
Over the last 2 years, the school feeding program has been extended to secondary schools as part of a pilot program. One mother is speaking out against the woes of sending her children back to school after yet another long break forced on the nation due to COVID-19. The mother says she was never in favor of schools closing their doors, as this decision has caused a myriad of issues ranging from children not being in the right frame of mind for school to them not fitting into their uniforms anymore after gaining the quote-unquote COVID weight.
With the topic of back to school being a major talking point as schools island-wide are expected to open their doors on Monday the 11th of January, one mother has expressed her mixed feelings on the big date. Kathleen Modest told Hot 7 News that her apprehension has nothing to do with not wanting to send her children back to school, In fact, her feeling on the matter is the complete opposite of this notion. What she is concerned about, however, is whether the children are ready for school in so many more ways than one, including whether their uniforms still fit.
I was never in favor of school closing in the first place. My reason for this is I have a grade 6-year-old, I have a grade 6, and then I have a grade 2. School opening Monday, I couldn't wait for school to open. I am one of those parents. I will not be wait when school closes. The children have too much time on, especially this time around with COVID. They had too much time on their hands. My sons, they got so big. Now I have new uniforms to buy. I have new socks. Majority of their socks, okay, I don't know where they went to. New masks, because also them, they were misplaced and all of that. And then they were home for so long. I've heard a lot of parents complaining. I will complain that too, that the children, they change. Their whole attitude has changed in terms of they can barely be controlled. It's like they're so energetic. You cannot control them. You cannot get them to settle and all of that.
Modest said the closure has also left her children uneasy about returning for the fear that their worlds will be rocked once again.
So they want to, they don't want to. Because they were saying things like, Mommy, I don't want to go to school and then school will close again and whatever. I think they're ready for school, especially my grade 6er. He is ready for school on Monday.
The outspoken mother said she is not the only parent with this issue, as many have complained to her through her capacity as a local PTA president. However, she said Monday the problem will be extremely apparent.
I know for a fact on Monday I will see some children with uniforms that are just odd. Some parents wouldn't be able to get the uniform. Some of them might not be able to get the uniform, and that's a fact. Some of them cannot afford to get the uniform. I don't think the ministry can really do anything to help because, come on, their hands are tied also. But I have no idea. Maybe my son's supposed to wear brown socks. Maybe I'll get socks or church socks, maybe.
Schools island-wide were abruptly shut down in October 2020 after one student from the Castries Comprehensive Secondary School tested positive for COVID-19. Reporting for Hot 7 News, I am Rochelle Gonzalez.
Stay with us. Still to come, 2 new cases of COVID-19, an appeal for greater employment opportunities for inner city youth, and CDC residents have their say on the color scheme amid raging debate.